I'm requesting him to talk on this very interesting subject. It'll be a short talk. I want it as part of this conference proceedings. The talk is titled, Does BMI Influence Oocyte Volume and Functioning in IVF ICSI Cycles? We've never heard this topic here before. I welcome Professor Ellenbogen.
Thank you. Thank you very much again. Thank you very much again to be invited here. It's my honor to give this particular lecture to such an impressive audience, and again to help to thank Gautam for his invitation. Now, I would like to ask you a question. You know, you always thought and knew that the oocyte is the largest cell in our body, and you can imagine why. But what I would like to ask you, the audience, in your opinion, if we'll have obese women and the lean women, in which women can we find a larger oocyte? In an obese that have a lot of energy, or in a lean? What do you think? Who could favor the obese? Please raise your hand. Okay. And the lean women? And the other have no idea. Okay, we shall try to demonstrate that. Okay, we can know that in animal model of obese and insulin-resistant mice, we can see a delayed maturation of oocytes, smaller oocyte size, and increased granulosa cell apoptosis. Abnormal physiology affecting oocytes and resulting in abnormal pregnancy outcome was shown in bovine, canine, and goat models, and this finding may be linked to adverse embryonic and fetal outcome, including delayed embryonic development, growth restriction, anatomic defect, even small fetuses. What happened in women? In human, excess body fat is associated with chronic oligoanovulation. Infertility may be due to hyperinsulinemia and ovarian hyperandrogenemia. Obesity, as we well know, is associated with higher rate of miscarriage, higher prevalence of gestational diabetes, as well as pregnancy-induced hypertension, and many other complications. We know that obesity induces elevation in insulin, elevation in glucose, elevation in free fatty acids. It appears to impact the development competence of the oocytes as well as other tissue as sperm, and we always know that obese men have lower potential of fertility and have lower spermatogenic count. Embryo, placenta, and even uterine environment. Negative environment exposure may affect the development competence of the oocytes, defined as the ability of the oocytes to be fertilized and support embryo development. In IVF cycle, obesity may influence oocyte retrieval, and there are controversial data regarding the numbers of oocytes collected in obese patients, the oocyte quality and maturity, fertilization rate, embryo quality, and definitely pregnancy rate. This is the only one, the first and the single article in the literature that I could find in human about dealing the female obesity that adversely affect assisted reproductive technology. And in this very interesting paper by Luke, it was demonstrated that obesity or obese women and PCO women independently, each for other, in these patients, the oocytes volume were smaller than in lean patients. Actually, what they did, they measured the full diameter of the oocytes. So our hypothesis was if oocytes quality is influenced by metabolic condition, it's possible that this condition and the result of the oocytes may affect the pregnancy outcome. We know that obesity may negatively affect oocytes quality, but this was never proven actually. And whether metabolic conditions that are developed into the oocytes are the reason for this condition in humans actually is not known. it is the same, in the same journal we found this paper of Marquardt that again, he looked at the oocytes of in PCOS women and also show very interestingly that in women that are obese and PCOS, the oocyte diameter is smaller than in lean women, again independently. So the aim of our study was to evaluate the effect of two distinct different BMI groups and to follow embryo performance and to correlate it to pregnancy results. Because actually what we do know, and there are a lot of articles concerning the effect of obesity in pregnancy rate, and we know that there are lower fertilization rate, lower implantation rate, and even higher abortion rate. So the question is why? Why it is happened? Because the fat tissue itself, or the, what we call the pro-inflammation situation caused by the fat, or something more basically. And we think that actually what it's happened in the oocyte itself. So actually, we describe and we look at two groups of women. One women that there were women undergoing IVF ICSI cycle, age less than 35, lower FSH level, women that more than 4 oocytes were collected per patient, and patients were recruited in two subgroups according to the BMI, obese over 30 and lean less than 25. Exclusion criteria were women over 35 years of age, poor ovarian reserve, women that were taking other adjuvants in order to improve fertility conditions as DHEA, steroids, and so on, and definitely BMI that were between 25 and 30 in order not to have an overlapping between the BMIs. And we evaluated actually the BMI on the number of oocytes retrieved, number of mature oocytes, fertilization and cleavage rate, oocyte diameter and volume, number of top quality embryos, and pregnancy rate. As you can see, all oocytes were captured after the nudation on the granulosa before ICSI, and we photograph actually the oocytes by Olympus camera in the inverted microscope. A Zeros laser and software allowed us to the measurement of computer-captured digital images using built-in tools that automatically calculated the mean and standard deviation of each measurement. We measure the diameter of each mature oocyte, separately the zona pellucida and separately the oolema, and calculate the oocyte volume. And this was done because we actually, in the article that I showed you previously, they measured all the diameter of the oocyte. So we wanted to see actually which is responsible for the change, maybe the change in the oocyte volume, the oolema itself, or maybe the zona pellucida. So actually what we measure, this is the oolema diameter, the zona pellucida diameter, actually all the diameter of the oocytes from outside to outside, including the zona, and then we calculated the volume of the oocytes accordingly. And those are the results. There are 10 patients that were obese, 16 patients that were lean. We tested 77 oocytes of obese patients and 149 oocytes of lean patients. You can see that the age, estradiol, FSH, all the characteristics of the group were actually the same. And about oocyte measurement. Again, 77 oocytes we measured in the obese, 149 in lean. The full oocyte diameter was actually lower, smaller in obese patients than in lean, and you can see that was statistically significant difference. The full volume, the oolema diameter, and the oolema volume, the full volume, oolema diameter, and the full volume were smaller in the obese group, but not the zona pellucida. So it seems that actually what happened in the obese women that the volume of oolema itself is smaller and not all the oocyte. And this is a very, very important finding, as you can see here. Now, afterwards, we wanted to see what are the effects of these measurements on the pregnancy, on the treatment outcome. And what is very important, and because short of time, I shall show only the significant results, the top quality embryos were significantly lower in the obese women than in lean women. You can see top quality embryos were 33% versus 49% in the lean women. And the pregnancy rate, indeed, it's a very small group. You cannot calculate pregnancy rate. We cannot say that it's actually a powerful statistical analysis, but actually was only 37% in the obese and 50% the pregnancy in the lean patients, as you can see here. So we demonstrated, and I think for the first time in the literature, that oocytes for obese patients have lower volume than from lean patients, not to any difference in the thickness of the zona pellucida. And it's possible that this finding may be caused by an abnormal metabolism of fat in oocytes of obese patients, causing a decrease in vital elements needed for energy buildup in those oocytes. A direct correlation was found between oocyte volume and oocyte function, and we showed worse oocyte performance in obese patients in means of higher dosage of gonadotropin use, less top quality embryos, and lower pregnancy rate. Our study suggests, for the first time, that the results of in vitro fertilization treatment are correlated with body mass index due to a possible defect in oocyte volume, and obesity predisposes women to several general and obstetric complications such preeclampsia and so on. So we recommended lifestyle change for patients who are not within the normal weight range. And finally, what we want to see in the future, to expand the number of tested oocytes, to follow pregnancy outcome of a larger number of patients, to evaluate the changes that can happen with weight loss, mainly after operations, and more important, actually what we are now performing in the lab in correlation-wise, my friend Professor Feinaru and other members of my group, to elucidate the exact cause of reduced volume of oocytes obtained from these obese patients, mainly to understand actually the metabolic processes that are disturbed in the fat metabolism in the oocytes. I want to thank you very much for your attention.